really heard about living donor transplantation when the doctors advised me that my kidneys were deteriorating, and obviously I would be needing the possibility of a transplant. And then obviously the words were mentioned then to me. Prior to that, obviously, I was only aware from people carrying donor cards, but not really much further information than that, really.
But when we were actually told that Sue needed the kidney, basically it was just at one of the consultations, and the doctor said that Sue would have to go on dialysis with a view to going into a donor. My first reaction was, well, put my name down, let's move forward.
Obviously, the concerns I had is sort of his success rate. Would it be successful for me to receive it? And obviously, how he would be affected by it, sort of physically and mentally.
I had no reservations at all of actually stepping forward to offer my kidney for Sue. Main reason being was Sue needed it. You know, the outcome far outweighed any concerns that if I'd had in my own mind. But no, it was as soon as the doctor had said Sue needed a transplant, I said yes. And my main thought process really was to erase all the pain and to get her back to the life that she should have without any fear. To myself, there was no concerns because the benefit far outweighed anything that may have happened to me. The support given to us by the transplant team and Lisa and everyone else was fantastic. Everything, you know, there was a DVD, there was booklets, there was also talking where they, you know, she said if there's any questions or anything you'd like to ask, then just please ask. We then spoke to other people who had or were going for transplants and had transplants, and we found they had a number of classes that they'd actually set up where you could actually, people that were being worked up towards having a transplant, both the donors and the recipients, could go and listen to people that have had them done already. And we found that the most rewarding really, because people were talking from first hand. And you know, it just answered all the questions, and you could actually talk to them afterwards, even to the extent of saying, well, you know, can I have a look at your scars? It was something that was really, there was just an openness and a support that was great. The screening process, I think, brings questions that you don't actually anticipate or appreciate. And the first question really is when someone says, well, have you got 2 kidneys? Because you don't know. You don't get up in the morning and go, oh yes, I've got 2 kidneys this morning. So I think that they put little barriers in that are quickly broken down, but you don't even think about it. My first reaction was, yes, put me down. Then it's, well, have you got 2? And you think, well, I never really thought about that. So I think that there was nothing particular that daunted me, but it was just the different questions that you weren't expecting to come up. But they deal with them so well, it's not a problem. One of the consultants actually went through all the aspects of the operation, both the traditional way, which would have been a large cut, and also the implications of time off after work and the recovery period, and also the benefits of keyhole surgery. And then it was your decision, but obviously you listen to what advice is given, and being, you know, knowing that I would have to have 2 or 3 months off work, I wanted to get back as soon as possible. And with technology moving on the way it is, the keyhole surgery seemed to be the way forward, and as it was, it went very, very successful. The recovery process is very swift, but also you have to bear in mind what you've just been through, and I think it's very easy to think I can start doing things, but you get a lot of advice on what you can and cannot do. After the operation, you're up and walking around, or shuffling around I should say, the next morning, and then 2 or 3 days afterwards you're on your way home. You have to take it easy and start walking around the block, making sure that you remember that although you haven't had the side of you completely sort of opened up, it is the muscles and everything that's centrally that has been worked on, and I think that's the most important thing to remember, that you don't overdo it. But I didn't find any problems at all. Within a week I was going up to see Sue in hospital, doing normal things, walking around the corner, and just generally sort of thinking, was it as easy as that? I went straight back into work without any real fears. I thought I would have to sort of go and start slowly, but by the nature of my job, it was straight in at the deep end. And although you have to make sure that you don't overdo it, it had no real adverse effects, especially physically. My job can be physical, and I had no adverse effects apart from the fact that you're still under orders really not to do any heavy lifting, and you must remember that. That's the main thing. That it's a lot of work has been done, and you mustn't undermine it by thinking, oh, I can do that.
The advice I would give to other renal patients is I always put myself in their shoes where I was before, and the things I found beneficial to me were to talk to people, obviously patients waiting in the waiting room. You get lots of information from people that have already had transplants. Just talk and ask questions, speak to the doctors, read leaflets, attend the talks that they have, and ask lots and lots of questions.
Anyone that's given the opportunity to consider living organ transplantation should really look at the benefits that will give to the person that's receiving it. Looking now with the change of legislation that's come in that wasn't there when we had ours, even if you're in a position that you can donate to someone that is not particularly your family or your partner, bear in mind that there's someone outside there that would also be able to donate to your people. So, without living organ transplant donation, things are going to dry up. The lists will get longer. I'm sitting here 13 months after, thinking it's the best thing that I've ever done. And at the end of the day, it's brought a lot of pleasure, both to me, but also to Sue, my wife. And the thing is, I would do it all over again if I had the opportunity.
The transplant itself has changed my life incredibly. I was on dialysis, albeit a short period of time, but it's given me my life back. It's taken away the severe routine that you have to undergo with dialysis. I can do lots more activities, go out when I want to. I've got freedom back. It's given me a real zing and a different outlook to life. I just want to live it to the full. Obviously nurture my kidney with tender loving care because of obviously where it's come from. It's made me a very confident person, changed my whole attitude.
I think the relationship that I have with Sue has been one of the strongest. She's my best mate anyway, and always has been, and I think it's just improved on that. I think the thing now is that we always had an understanding and we always used to almost think the same things. Now it's almost like we're one, and it's spooky. It is spooky, and there's certain things that Sue does now that would never ever have done before. The World Cup was on and Sue was never a football fan, and it was like she was telling me when the football was on, and it was like, where did that come from?
Obviously, receiving the kidney from Tim is obviously very special and very close to my heart. It has brought us far closer. We've always been a close couple anyway, but in what way, I'm not too sure really. I think I tend to appreciate him possibly more. I'm getting all...